and everywhere I went to ask me what on earth Republicans were going to do to their health care. Now, with just a month to go in 2017, even though we have stopped Republicans from taking people's health care away time and time again, we are right back on red alert. Families across the country are again having to worry about the same question that has worried them all year long. What's going to happen to me and my family if Republicans rip apart the health care system? Because that is exactly what the Republican tax reform bill would do. This bill, which Republicans are trying to claim would lower middle-class taxes, would actually raise them to pay for more tax breaks for massive corporations and those at the top. And one of the worst ways this bill hurts working families is by undermining their health care. If President Trump signs this tax reform bill into law, 13 million people fewer will have health care coverage. Premiums are going to go up, and experts say that uncertainty and confusion in the markets will lead to fewer coverage options for families. Under the Republican vision for our tax code, big corporations, the wealthy get tax breaks, and patients lose coverage they desperately need. This is just wrong, and what makes it worse is the way Republican leaders are trying to deny it. Instead of admitting just how bad their bill would be for the very same people they wrongly say they're going to help, Republican leaders are hiding behind the bipartisan bill Chairman Alexander and I put forward with strong support from both sides of the aisle. Let's be clear, our bill was designed to help solve the problems that already exist because of healthcare sabotage we have seen from President Trump and Republicans all year. It will not do a thing to give coverage back to the 13 million people who will lose it under the tax reform bill, or keep premiums from going up by another 10% each year after 2019 as they would under the Republican tax bill. This is like using a shovel to stay dry in a rainstorm. It will not work. And after a year of hearing just how bad the Republican plan on health care is, you better believe people in this country know it. Families across the country have heard exactly what Republicans are selling when it comes to premiums and coverage, and they've been abundantly clear they do not buy it. Republican leaders are only fooling themselves. They are not fooling anyone else. So it is well past time they realized it and focused on bipartisan steps to actually solve problems instead of once again retreating to their partisan corner and creating problems. Thank you, and I want to turn it over to Senator Bennet.
Thank you. Whoops. Thanks, Patty. I want to begin where Patty ended, which is to say how much I support the work that she and Senator Alexander have done together on the Help Committee. That is a committee that has been an island in a partisan storm for the 9 years that I've been here. And we have achieved bipartisan result after bipartisan result when Democrats were in charge, when Republicans were in charge, because the committee works together to improve a product and to actually have testimony from people about what's wrong with the healthcare system in this case and how to fix it. And Alexander Murray is completely responsive to that, whereas the bill we have on the floor this week is not. I used to say when they were trying to pass their healthcare repeal bill around here, which was which in that case was a set of tax cuts masquerading as a healthcare bill. Now we have a tax cut bill masquerading as a health care bill, or maybe vice versa. But in any case, I used to say that if I set out to write a bill less responsive to the critics of Obamacare in Colorado, to say nothing of the supporters of the Affordable Care Act, I could not have written a bill less responsive than the bill that they tried to pass through the House and tried to pass through the Senate. And that's the reason why, in the end, those partisan attempts on health care failed. And it's the reason this partisan attempt on health care needs to fail, because not only is it not responsive to the critics of the Affordable Care Act in Colorado, it actually goes in the opposite direction by creating less security, less affordability, and less predictability. And in a shameful footnote to all of this, it does so in a tax bill that has nothing to do with health care, and that is taking billions of dollars from working class people in my state who are going to have to pay back the debt for a tax cut that's going to benefit the most affluent people in the country. Colorado doesn't support that bill. The state is a third Democratic, a third Republican, and a third independent, and you'd have to work very hard to find somebody who would support the substance of the bill once they know what's in it, which is why they've run the process the way they have. Not giving the American people the opportunity to weigh in, not having a single hearing on this bill in the Finance Committee before we had the markup last week. It's not the way we ought to be running things around here, and it's certainly not the way we're going to produce help on health care, which our states desperately need, and it's not going to produce fairness in our tax code. And with that, let me turn it over to my colleague from New Hampshire, Maggie Hassan.
Well, thank you. Thank you, Senator Murray and Senator Bennet. Look, for the majority of this year, our Republican colleagues have been engaged in truly partisan efforts that would rip health insurance away from millions of Americans. That includes their attempts to pass Trump care. And the Trump administration's efforts to sabotage our health care system are already raising health care premiums and squeezing hardworking people in New Hampshire and all across the country. I've heard from people in New Hampshire who are affected by these increases in premiums due to the sabotage. And what I hear from them over and over again is that they want us to work together to bring down health care costs. Unfortunately, what we see in the Republican tax bill now before us is doing exactly the opposite. It was already clear that the Republican tax plan would mean a tax increase for millions of middle-class families and property taxpayers. According to the Joint Committee on Taxation, millions of families earning less than $75,000 a year would get a tax increase. And a new report from the Congressional Budget Office showed that poor Americans would be even worse off than originally projected under this tax bill. At the same time, the provision to repeal part of the Affordable Care Act in this tax bill would drive up the cost of health insurance. This partisan plan would leave 13 million without insurance and cause health care premiums to rise an additional 10% a year in the individual market, all to give tax breaks to corporate special interests. This legislation is also fiscally irresponsible by dramatically increasing the budget deficit and setting the stage for cuts to Medicare, Social Security, and other critical priorities. Recent analysis shows that this plan could risk triggering a $25 billion cut to Medicare. This isn't tax reform, and we have to do better. I will work with anyone who is serious about expanding opportunity for middle-class families and small businesses, but that isn't what this tax plan does. Over the past several months, people have repeatedly stood to defeat partisan efforts that would raise health care premiums and take away coverage from millions and millions of Americans. I'll continue to fight with my colleagues to support the priorities of the people we represent, not the priorities of the corporate special interests that would disproportionately benefit from the provisions in this tax bill. To Senator Bennett's point, the Alexander Murray health care bill is a phenomenal example of what we are capable of doing together. 12 Republicans, 12 Democrats on that bill, lots of bipartisan support for it. There are other examples of bipartisan work we've been able to do here this year, and lots of us interested in doing it. We really need people to come together and do what our constituents do every day in their daily lives, which is solve problems, and they do it without regard to political party. They just come together and figure out a way to move forward in their business or their families or their communities. We need to do the same thing. Thank you.
Thank you. Happy to take questions. Yes. It is now up to Republicans to take the provision out and not create complete chaos, 13 million Americans losing their coverage, probably bare counties in the country where they will not offer insurance because of the uncertainty and the cost increase, and families having to pay more. They can take it out of their bill, and that's what we're asking them to do.
If they don't, will Democrats as a group specifically oppose Alexander Murray at that point, just because, as you said, it doesn't address?
The point here today is that we've gone through an entire year where Republicans tried to implement Obamacare, and American people stood up, out, and said no. After those attempts failed, our committee, on a bipartisan basis, said, what are the challenges? And one of the challenges was the CSR payments and some of the flexibility that's required. We heard testimony from governors, both parties, from insurance commissions, both parties. More than half of our senators went and listened, and our bill was addressed to design the problems that we saw. We did not hear any testimony. In fact, we heard opposite testimony about taking away the individual mandate almost across the board. Don't do that because of the chaos it will create. So the bill we designed is not been written or backed in order to solve the problems the Republicans are now creating. So the question isn't whether we support Murray Alexander. We've been saying for 2 months, let's get this passed and bring some certainty. The question is, are they going to create such chaos that Murray Alexander won't be able to solve the problems they've created? Other questions? Well, the path forward would have been to pass it 2 months ago. The path forward is, of course, to bring it up, but the real path forward is to take out the individual mandate provisions in the tax bill that will create such cost effects that in chaos that, you know, our bill may not even be effective if we were to implement it. Yeah.
Are you going to offer an amendment during the reconciliation on the floor to do that?
To take it out?
Yeah.
That's up to the Republicans. They're in the majority. They will decide what's in and what's out.
No, I mean, are you going to offer an amendment to do that?
You know, we haven't made a decision on all of our amendments. Obviously, under reconciliation instructions, it's very hard to offer amendments that don't have a budget point of order against them. They can do it before they bring it to the floor.
Yeah.
All right.
Thank you all very much.